Hi everybody, I'm Dr. Adam Rivadeneyra, or Dr. Riva, from Orthopedic Specialty Institute at Hoag Orthopedic Institute here in Orange County. Thanks for having me tonight. We're going to talk about sports medicine injuries and care for patients with a focus on all patients being athletes and possibly benefiting from sports medicine. If you have any questions for me, we are live tonight, so please write them in the comments section down below and we'll answer them after we go through these slides. But feel free to type any questions and we'll deal with those later. So for tonight's talk, I'll share a little bit about myself and our practice, talk about the difference between sports medicine and what orthopedics is as well. We'll talk about what to expect as a patient coming in to see us, how to describe what your goals are, meeting your expectations for your visit, describing several different injuries tonight, how to treat those potential injuries either with surgery or without, and then we'll deal with some questions. So I grew up here in Orange County. I went to San Clemente High School and then San Diego for college. After that, ended up working in chemistry, followed by medical school, and ultimately ended up for residency at University of Oklahoma for family medicine, followed by a one-year sports medicine fellowship. And we'll talk about that a little bit in a second at TCU. I then started my career doing a combination of primary care, so full spectrum family medicine with some sports medicine out of the area here before coming to Orthopedic Specialty Institute about 5 years ago. Back up for a second. So we currently work at Orthopedic Specialty Institute. We have two offices, one in Orange and one in Irvine. Work closely with the Hoag Health community and are happy to help. We're open 5 days a week. We have about 25 doctors or so in our office, physical therapy, MRIs, x-rays, and take care of several high schools and colleges in the area, as well as help out with the Chargers in the NFL, and as many pro athletes who are visiting in town or training locally. So as a patient, if you think you need to see an orthopedic surgeon or you have a bone issue, a joint issue, sprain, strain, some kind of injury or fall, you need to figure out who you want to go to. So I always recommend you think about what your goals are first, and we'll talk about those in a second. But the main difference between sports medicine like myself and an orthopedic surgeon, so I did 3 years of family medicine training first. So dealing with patients of all ages, from newborns to pregnant mothers to elderly patients and everyone in between. So I have a stronger medical background, but I don't do any surgery. And you can get into sports medicine from orthopedics, that's a very common one, family medicine, pediatrics, physiatry or physical medicine and rehab, or even emergency medicine or internal medicine. So you learn all about the medical aspect of it and then a little extra care in sports medicine. So orthopedics is a surgical specialty, so you do a residency in orthopedic surgery, which is typically longer, with additional fellowship training in sports medicine. Overall, we deal mostly with things that are more considered elective. You guys have probably heard that word in the last couple of years, elective surgeries, but that deals mostly with non-urgent, non-traumatic things like knees, shoulders, hips, elbows, sometimes foot and ankle issues, rarely spine issues, but sometimes in sports medicine. Orthopedics is much broader, dealing with spine, trauma, nerve injuries, broken bones, things like that. Sports medicine is a little less than comprehensive orthopedics, but also a little more precise and a little more catered to active individuals rather than traumatic injuries. We also have special training in concussion management, and then healthcare related to athletes and sports participation. Is it safe to compete? Do you have heart issues, diabetes, asthma, things like that? And we can help your sports performance by catering our treatments to those issues. A lot of patients come to see us to try and improve performance or have very specific questions. Can I do this race this weekend? Can I ride my bike this far? What kind of activities can I do with my injury or my history of surgery? So orthopedic surgeons will oftentimes stabilize something that's unstable, try and move something that's too stiff, repair something that's broken, replace something that is totally worn out, remove something that's in a spot where it shouldn't be, or realign or correct the alignment in your body. On the sports medicine side, a lot of times we're doing smaller procedures, fixing rotator cuffs in surgery, ACL reconstruction in our athletes who tear their ACL. taking loose pieces of cartilage out of joints to help them move better. So more arthroscopic surgery with cameras, smaller incisions, and things like that. Some of our sports surgeons do joint replacements as well, but we also have more surgeons that do primarily reconstructions and joint replacements for knee replacements, hip replacements, and shoulder replacements. So there's a lot of overlap. Myself as a primary care doctor and sports medicine fellowship trained, I'm biased against surgery in a lot of ways, but I cannot fix much of anything, so I really rely heavily on my surgical colleagues to do the hard work and fix what might be wrong in cases where it can be fixed. But that's not always the goal, so we'll move forward. Please remember to ask questions down below. So when you come see us, one of my first questions is, how can I help you today? Or what is your question for me? Or what are you hoping to accomplish in your visit today? Most of our office visits involve some kind of pain. Shoulder pain, knee pain, hip pain, some fall or injury. But some patients have very specific questions. And I think that's the most important thing you can learn as a patient, is to come in and see us with a very specific question. Am I going to cause more harm? Can I go on this trip? What can I do? Am I going to make my problem worse if I continue to do things? Or, what does surgery look like for this? Do I need surgery for this? So pain relief is one of the most common things we deal with, but in my mind as your doctor, I think about your pain most often when it's affecting your function. Can you continue to do what you want to do even though you have pain, or is the pain stopping you from doing something? Is it keeping you awake at night? Can you lift up your kids? Can you drive your car to work? Can you do your job? Or can you do the sports or activities you like to do? If you can still do those things, your pain is usually less important to us, as long as we can maximize your function and your performance. If pain is limiting, we will absolutely try and get rid of that pain for you, or at least reduce it to a place where you can do more of what you want to do. Ultimately, we want to reduce your future risk for injury, worsening problems in your joints or your bones or your ligaments. If you have a problem that has already been fixed, we want to monitor that. We can take new x-rays, do ultrasounds, MRIs, and come up with a plan for you for the future. Ultimately, every visit we want you to come away with a diagnosis, or at least a plan to come up with your diagnosis before we make a treatment plan. If your question is simple, can I go on this trip? Can I ride my bike this weekend? Can I run this race? Hopefully we can give you an answer and discuss what risk you might have by doing that, or how well can you actually perform. So a lot of reasons patients come in to see us are for pain, and a lot of questions we'll ask you. It's really helpful to think about it ahead of time. Is this a new injury? Is this something that happened when you were in high school? Has it been bothering you for days, weeks, months, or years? Is your arm or your leg too stiff, or is it too loose? Are you doing too much of one movement? Working construction using a hammer, things like that, where you're doing the same thing over and over again. Are you doing too little of certain things? Are you sitting too much, not walking enough? Are you using things improperly, tools that don't fit you properly, a bike that's too small or too big, or doesn't fit you correctly? Let's see. Are you doing things for too long? Have you gained weight or lost weight? Have you lost muscle? Or have you gained a lot of muscle recently and now you don't move like you used to and still trying to do the same things? Are you sleeping enough? Are you getting enough rest and recovery time? Do you have new health issues that are maybe contributing that might cause pain? Infections or trouble breathing, things that don't allow you to do the activities you like to do. We can help with all those things and help coordinate with your other doctors. So what treatments are available? Myself being biased as a non-surgeon, we always think about your function first, like we already talked about. The best way that a lot of our colleagues can help you and help us together is to go to physical therapy or have a really well-designed home exercise program to teach you the right way to move, to do so with better function, better mobility, hopefully less pain, but sometimes that's a painful process going through physical therapy, and we'll try to remind you of that. So that if we send you to a physical therapist, expect to have a little bit of work to do. New exercises, stretches, strengthening things that are going to be difficult and painful at first, but ultimately to get you moving better and having less pain eventually. If things are moving too much, we brace you, put you in different types of braces for comfort or stability. We can use different medications that we'll talk about a little bit more in a minute. Sometimes I do a lot of injections for pain relief. focused injections with ultrasound guidance, put them in the right spot to help diagnose and hopefully to help treat. Things like ice or heat or compression wraps. We modify your activity and see what works for you. And then, of course, surgical options. Is your problem you have something that can be fixed? Some things there's not a fix for, and we help maximize what you can do even though you still have that, anatomical problem. If it can be fixed, should it be? Or when should it be fixed? What's going on in your life that is important to you? What you need? What's your timeline on when you can have this surgery? Because like we already said, a lot of these are elective procedures that you can get fixed. Or if you wait too long, is it too far gone that it can't be fixed anymore? And then of course, what kind of surgery? What are the risks, benefits, and alternatives? So medications are a common thing that people try. Supplements, of course. Topical anti-inflammatories or cold creams, things like that. Acetaminophen or Tylenol, non-steroid anti-inflammatories, things like ibuprofen, naproxen, meloxicam, Celebrex. There's so many to choose from. They all have risks, so we'll talk about those when you come in and see us. Narcotics for severe pain or surgical pain. CBD treatments, things like that are available now. Injections in the office with ultrasound guidance, feeling around on your body and finding the right spot, or using x-ray guidance to put the medicine where we want it. Either with steroids or cortisone, hyaluronic acid for arthritis, which is kind of a lubricating gel, other anti-inflammatory injections like Toradol, prolotherapy like saline or sugar solutions, regenerative options, which don't really rebuild anything, but orthobiologics is another name for those, things like platelet-rich plasma, bone marrow stem cell injections, or something similar. And we do a lot of diagnostic anesthetic-only injections. So if a certain part of your body hurts and we can't figure out exactly where the pain's coming from, we can use a little bit of numbing medication relatively painlessly to numb up certain spots until we find the answer. So ultimately, whatever it takes to get you a good diagnosis and treatment plan is what we're aiming for. Surgery, very common. So knee surgeries in sports medicine, ACL reconstruction, meniscus surgeries, loose body removals from your knee, fixing your tendons if they get torn off the bone. Do you have a cartilage injury that can be fixed or repaired? Or fracture repairs and healing. Shoulder surgeries, if you tear your rotator cuff, you tear your labrum. If you have shoulder impingement or arthritis in your shoulder, to decompress that. Or if you fall and break your arm, to fix that too. Elbow surgeries like Tommy John surgery, tendon repairs for tennis elbow and things like that. Hip surgeries that are minimally invasive like labral surgeries, impingement surgeries, or reattaching your hamstring or your gluteal tendons if they tear off. Very few, but some knee replacements, shoulder replacements, and hip replacements. So what can you do? The best thing is to stay active, find what you like to do, figure out a way to do it, and let us help you if you can't do it anymore, or come up with better ideas. Stay active, stay mobile, get plenty of rest, eat well, exercise. If you need them, take supplements, but usually only if you have a deficiency to help benefit that. Manage your medical issues. Deal with your asthma, COPD, heart failure, hypertension, diabetes, all of those things. Bone health, maintain your bone density and know what your numbers are. Focus on mental health. Exercise is a great way for that to stay positive and stay motivated. Join a gym, work out with a group. There's lots of resources in the area to help with all of that. And come ask us. We know lots of people in the area to help with. Hoag has great resources from a community standpoint, physical therapy standpoint to get involved. And we'll take some questions, so thank you for submitting some so far. First question tonight is about arthritis. Is regular consumption of glucosamine good for athletes, or do I recommend any other supplements? Glucosamine is a common supplement that is used for arthritis pain relief. Over the years, it's gone back and forth in medical research. Is it helpful? Is it not? But we definitely know that it's safe, and it can help relieve some pain for some people with arthritis. It's not going to really build your cartilage up at all, but it can help with some arthritis or joint stiffness and pain. And it is safe. There's other things that go along with it, sometimes called chondroitin or MSM. Look into different products, different brands. The trouble with supplements in general is that a lot of them don't list exactly how much ingredient is in each of those supplements, so pay attention to the labels and go to a reputable source to buy them. Different pharmacies, natural markets, places like Costco that are pretty stringent with their supply of medications. And talk to your doctor as well to make sure there's no interactions with your other medications. Other supplements we recommend, there's been some good research in the last several years about turmeric as an anti-inflammatory. It's a natural substance, food additive in many cases, used in different seasonings, and it can help reduce pain as well. Some studies even show similar improvement as ibuprofen. If you take turmeric 3 times a day, it can help reduce your pain. A lot of people ask about CBD treatments and supplements like that. There's a growing amount of research in that, but also, talk to your friends and neighbors, your doctors, about what they're using. Is it helping, or are they having any complications from it? But there's lots out there. Most people don't need supplements if they have a normal diet in our area, but some of them can be helpful. Next question. Do I have any recommendations for quadricep tendonitis recovery? So the quadriceps are big, strong muscles in the front of your thighs. Common source of pain at the top of your kneecap. Excuse me. At the top of your kneecap, if you get tendonitis in those quadriceps. Normally that's an issue related to improper use, either too much or too little of certain movements. Your individual case may be different either side of that, too much or too little. Common in jumpers, so we see that a lot in volleyball players, basketball players, track and field athletes or runners. Sometimes this time of year after the ski season, a lot of people have tendonitis if they've been on the mountain a lot. The best treatment for it is a good stretching and strengthening program to help lengthen that tendon under control, to build tolerance to repetitive lengthening and contracting of that tendon. Physical therapy is a major improvement for that, so highly recommend physical therapy for it. Unfortunately, it takes time. There's no quick fix for these things. It probably developed over a long time, so it's going to take a little while to go away, sometimes several months. It's not usually dangerous. You can normally, if you can tolerate the pain, continue to do what you like to do, unless there's more damage there. In severe cases, after it's been there for a while, you've tried physical therapy. Sometimes we use a needle to help you, whether we just poke holes in the tendon called a tenotomy, or we inject different substances, whether it's saline or dextrose solution like prolotherapy, or even platelet-rich plasma can help with chronic tendonitis pain. At that point, it's not really inflamed anymore, so we call it tendinosis or tendinopathy. But still, physical therapy and a good exercise program is the best treatment for that. Any other questions at this point? We're happy to answer some, but thanks for tuning in. Watch again if you have any more questions. Call us if you need an appointment. Our number's at the bottom of the screen there for you. And keep things moving, and come see us if you have any concerns or questions. Thank you.